Hi everyone, this is Michelle from the Snooze Clinic and welcome to another episode of Sleep Talk. Okay, in today's episode, we have Dr. Ng Chee Hon from OMIC, or Oral Maxillofacial and Implant Clinic, to share with us a little bit on what he does, or in general what dental clinics do to manage patients with obstructive sleep apnea. So at the start of his presentation, he shares a bit on the typical features of facial structure patients with obstructive sleep apnea may have, and after which he talks about, or he gives a general overview of the treatment methods which they use for people with obstructive sleep apnea, and this includes oral appliances, also known as mandibular advancement devices, or the surgery that he does, which is known as mandibular advancement surgery, I think. Is that what it's called? Okay, I'm not too sure, so over to him.
Hello everyone, I'm Dr. Ng Chee Hon from Oral and Maxillofacial and Implant Clinic. Today I wanted to show you in a very light-hearted manner what is the Maxillomandibular advancement surgery and how it can help obstructive sleep apnea patients. So what is the obstructive sleep apnea? It's a condition characterized by episodic obstruction to the airway flow when we are having deep sleep. So generally can be divided to mild, moderate and severe, and the population of people seem to be affected are the young children and predominant males, although some females may have the condition. And in such individual, usually marked by obesity, and also we have wide neck circumference, and then coupled with retruded chin, the individual have very narrow dental arches and a high arch palate. Sometimes we also may find an enlarged tongue. In a very small population of female, this is mirrored in a condition called HSF. This individual also are marked by a wide neck circumference, retruded chin, the dental arches are also narrow, and they got a high arch palate. So how do we describe the airway? So the airway nowadays we come to understand better because we got modernization of imaging. So available at most premier clinics, we have the CBCT and CBCT help us do quantitative evaluation of the airway. So generally the airway is divided into three parts: the nasopharynx, the oropharynx, and then the hypopharynx. And through studies, we know patients with obstructive sleep apnea, they tend to have narrowing in the oropharynx, and this is what we want to improve in maxillomandibular advancement surgery. So simple things first, maybe generally as surgeons we try to offer something that is simple and easy to institute prior to surgery. So we have used mandibular advancement devices for more than 10 to 20 years now, and we have fairly good success in treating patients with mild to moderate obstructive sleep apnea. So have a look at this simple appliance. It's actually positioning the mandibular forward so that we have less chance of the tongue being flipped back into the airway. And clinically and through studies, we know that there is improvement with the use of these appliances. And similarly, we know mandibular advancement device cannot give us a complete cure or improvement from our obstructive sleep apnea. Sometimes we want improvement, and the disadvantage of the mandibular advancement devices are difficulty in wearing, appliance breakages, and sometimes we got teeth problem, and sometimes our patients also report malocclusion. So in maxillomandibular advancement surgery, it's very unique and tailored approach to bring the maxilla or the upper jaw forward by 10 millimeter and the lower jaw by 10 millimeter, and usually we do genoplasty or glossal advancement to a variable extent, and this helps to bring the tongue down as well as the hyoid superiorly. So many parameters have shown that maxillomandibular advancement surgery can bring out a good correction of the upper airway, and a good measure is the posterior airway space, and this posterior airway space actually give us in about 80% of our population 80% improvement in the AHI or the sleep quality. So as we know, obstructive sleep apnea is multifold, multi-level. So just want to highlight all of us with concerns of obstructive sleep apnea, please go find your professional to assist you, because OSA is very often linked with hypertension, cardiovascular disease or heart attack. It may possibly give rise to a stroke. So it's a multifold, multi-pronged approach. And so we like to let you all know, first step, maybe we look at sleep environment improvement, and then the other self-care methods include try sleeping on the side rather than on your back to prevent the throat from falling back, and then try not to smoke or drink alcohol. Do not take on board sleep medication. Do improve your sleep hygiene. A little loss of weight can help to improve sleep apnea. Here I wanted to show you some studies very simply with bariatric surgery or reducing food intake can dramatically help you improve your obstructive sleep apnea outcome. Weight reduction can give you changes in your neck dimension, which have a direct impact to your oral pharyngeal airway. That's why oral maxillofacial surgeon, we always like to emphasize we have clear communication with our sleep specialists. We have clear communications with our ENT experts. We have clear communication with a respiratory physician before we consider our armamentarium of oral and maxillofacial surgery. So such surgery include mandibular advancement surgery to bring the upper jaw forward, the lower jaw forward, as well as considering whether we have enough tongue space. So sometimes tongue reductive surgery is done, and then also we like to posture the hyoid bone superiorly. So sometimes we might like to consider genoplasty, genoglossal advancement in the context of BIMAX surgery. So putting things in context, our patients would have already some form of wellness advice with regards to their lipid management. They would have possibly trial of CPAP, and then what good surgeons and good practitioners will do, we would have already instituted the oral appliance and consulted the sleep physicians and the respiratory physician, because these are all in part consideration for pre-surgery requirements as well as post-surgery requirements. So we would have already also discuss this with the ENT surgeon, see whether we can maximize the airway enlargement. So patient would have already considered the UPPP surgery. They would have considered removing the uvulus in the males, adult males, and then in children we would like ideally them removing the adenoids and the excessive tonsillar tissue, and finally we like to do the maxillomandibular advancement surgery. So last note for you, we have a wide armamentarium in oral and maxillofacial surgery, but we wish you consider simple measures first. If you have concerns, then possibly consult with some of the experts I already have enumerated. But I leave you with one food for thought. Maybe one day we will find a magic bullet. So hopefully one day this day will come where individual medicines can come together and give you a comprehensive treatment. So with that, I thank you very much from all of us at Oral and Maxillofacial Implant Clinic.
Thank you, Dr. Ng, for sharing with us your profound presentation. But it was very enlightening. Yeah, it was very enlightening to see the dental point of view when it comes to treating patients with obstructive sleep apnea. So yeah, thank you, Dr. Ng, for also sharing some tips as to how patients can make their sleep a better one. Yeah, by little alterations to the environment in which the patient sleeps. So yes, I think all these are pretty important if you want to get good sleep. It's not just about using a CPAP machine, it's not just about losing weight, it's not just about sleeping on your side. It's actually a combination of many things together that can optimize your sleep quality. Yeah, so okay, that's all for now. I will see you soon. Bye. Okay.
You know, it's Mrs. Low. Today she still complains that she got mandibular cheilitis. Last time we gave her some Vaseline. She felt that it didn't